Hi, this is Dr. Joel Carmichael, Center for Spine, Sport, and Physical Medicine. Thanks for joining me today. I want to teach you how to treat your herniated disc in your low back at home. How would that be? We use this quite successfully, used it for almost 28 years now in clinic. These are called McKenzie extension exercises. And I'm going to go into a little detail, so if you don't have time now, grab a cup of coffee or some tea, whatever, and get back here and watch this. This will help you. This is counterintuitive. Extension exercises don't seem to be the right thing to do, but in fact, for most people with disc herniations, this works best for about 85 to 90% of patients. So here's how we do this. These are done lying flat on the floor or on your bed. Here today, I'm using chairs so that you can see what I'm doing. I forgive my old body here, but bear with me. Here we go. So to do a McKenzie extension exercise, the goal is to get the pain that's going down your leg to come up out of your leg. Now that means that the pain might be worse in your low back. That's okay. If it's worse in your low back, you're actually doing the right thing. If it's less in your thigh, in your calf, or in your foot, okay? So if it's less, that's called centralization. If, however, when you do these maneuvers, you're getting more pain into your thigh, into your calf, or into your foot, that's bad. That's called peripheralization, and you don't want to do that, okay? So here we go, McKenzie extension exercise. First thing you're going to do is you're going to lie face down very comfortably on the bed or on the floor. I prefer the floor, firmer surface. And you're just going to relax your abdomen. What you're trying to do is let everything relax. What most people do when I ask them to then do a pop-up onto their elbows, what most people do is they do this, because we've been taught since we were kids to keep your tummy tight, keep it tight. What we want to do is we want you to actually relax everything. This is your chance, everyone, to let it all hang out, okay? So I want you to just totally relax. Relax your butt muscles. You're not actually holding a dime between your cheeks. Let that dime go, let it go, and let your belly button relax. That's how to get into this nice sagging position. When you want your tummy to sag like a Buddha belly, just let it go. Okay? When you're in the elbow pop-up position, you're letting it all sag. You're holding that to a count of 10. And what you're doing is you're trying to feel what's happening to my pain in the butt, what's happening down the thigh, in the calf, in the foot. Is it getting less? Is it getting more? Obviously, if you can't do this, don't do this. But if you can, and if it's relaxing and easing up, you're on the right track. After 10 seconds, you want to relax. You relax for 10. After a count of 10, back up you go. For another count of 10, take a deep breath in, all the way in, blow it out, and when you blow it out, that's when you really want to let it sag. By letting it sag, you're going to actually cause that disc to float forward a little bit. No, it doesn't really float, but that's a good word. Floating forward, let it just totally sag. That causes the disc kind of to move forward and stop leaking and taking that inflammation away from the nerve root. So you'll feel less symptoms down your leg. Then again, you relax for 10 seconds, count of 10, a full count of 10. After you do that, you pop up again for another count of 10. Breath in. All the way out, blow it out, relax. Let's say that the pain is actually getting worse down your butt or down your thigh. The first thing to do, let's say it's down my left thigh, the first thing to do is to slide my hip and pelvis toward the right and my feet toward the left. So I'm kind of jackknifed a little bit. My pelvis is off center toward the right. And then I pop up and say, okay, is that any better? Is my leg better? Is my thigh better? Is my foot better? If it's better, then that's the position that you use. Well, if that doesn't work, then try jackknifing the other way. Hip and pelvis to the left, feet to the right. Take a breath in, blow it out, totally relax, and see what happens. All right, so you're going to do 10 of these. You do 10 up, hold it for a count of 10, relax for the count of 10, and you do this 10 times. How many times a day? You should try to do this 3 to 4 sets of 10 every single day. By doing this, what you're going to do is you're going to centralize your disc pain, and you're going to make it easier for me and for our colleagues at the Center for Spine, Sport, and Physical Medicine to fix it. Thanks very much.